I'm Amna.
And I'm Jess.
And we're fellows with Community Conversations Sister to Sister, a Black women's health initiative located in Cambridge, Massachusetts.
Every month, we gather at the local Black women's hair salon with fellow healthcare consumers as well as Black women healthcare providers to discuss culturally relevant and salient health topics.
For example, this past year we discussed breast cancer, sleep disorders, self-care, heart health and stress, among others.
These conversations are by and for Black women. Our healthcare experts look like our community and know our issues, specifically that Black women have higher morbidity and mortality rates and can face increased barriers to accessing care.
Our goal is to empower community members as they navigate the medical system in search of the highest quality care for themselves and their families. With this forum, we facilitate open, honest, and non-hierarchical dialogue in a space well known and familiar to many women, their local hair salon.
We have recruited a faculty of 150 Black women involved in medicine, science, and public health. They are drawn from leading health facilities in the Boston area, a healthcare mecca. We asked some of our faculty a simple question: what should Black women know about their health, their family's health, and their community's health? Check it out.
I think it's important to be a public health advocate. I think sometimes, and I've seen this in my own family, where you really would like to defer to the doctor and just trust that they're all-knowing, all-encompassing, and that you can just be a recipient of care. But you also have to be proactive, and that may not be the situation you'd like to be in. You might not want to sort of second-guess your doctor's opinion. And I think in many circumstances, your doctor's suggestions are on par and exactly what you need to have access to, or are exactly what you need. But I think it's also important just to be in the mindset where you're not just so trusting and that you're being proactive, because your doctor can give you the perfect recommendation. Your treatment plan or your risk management, preventative care can be exactly what it needs to be. But you need to have, I don't think that we can blindly trust that it is. And so we need to be informed consumers of health and be proactive in understanding what's available out there. I think it's also important because if we take that onus on ourselves as individuals, as family members, being proactive in our own health and our family's health, I think and also in our friends and our community, I think it creates a dialogue around health where even if your care is top-notch, by being proactive and by communicating and just having these conversations with individuals about sort of what they're getting, what you're getting, it allows other people to also see, hold up, my doctor didn't offer that to me. And I don't want to make this seem like it's something where doctors are negligent, or healthcare is constantly changing. A lot of it is experiential, and so you may not have seen a certain symptom or risk factor or something present in the same way that it is presenting in your patient. And so the solution or the thought process may not come to mind to you because you've just not been exposed to it. Medical school trains you for a lot, but it can't prepare you for everything. And then sometimes you have care providers who are not as familiar with certain populations, and so there may be things common in those populations that they're just not aware of, things that they wouldn't know to ask because it's just not a part of their normal, of the things that they've experienced with the patients that they have. And so if you're being proactive about your health, if you're communicating about your health to your friends and to your family, it allows that dialogue to happen within communities where you can see that, hold up, I actually didn't know that, and I don't know if my doctor knows that. And then you don't feel like you're questioning, judging, or testing your physician. You're just having a dialogue, because healthcare is at its best when patients and physicians are openly communicating with each other, and there's this streamline of trust and sort of camaraderie and sort of making sure that you have your best health. The other thing I think is important in sort of what I talked about was sort of being proactive, but I also want to make sure it's not necessarily talking about this openness and this transparency and communication about your health. You don't have to tell people everything. But I think that sometimes there are cultural practices by which we keep lots of things private, and it affects our family members the most. you hear quite often someone say, oh, my mom died of cancer in her early 40s. And even in my own family, you want to know, well, what kind of cancer? And people don't even know what kind of cancer it is. And it actually matters. It matters for my own risk. My grandmother had cancer. It matters for my own risk what type of cancer she has. Nobody really knows. Because it wasn't, and then I'm always told this, we didn't talk about those things back then. And even though you might say that is a generation and that was a cultural practice of not talking about health, I think it's something that's still prevalent today, and that's something that we need to try to actively address. Speaking about health, being proactive, and communicating about your health with your providers, with your family members, actually can improve the healthcare for all of us as a community. And I think it's really important that we see it as not something that needs to be private. Again, you don't have to say everything, but it can really help your family members to know exactly what kind of disease you have and what's going on with your health. And I think that it's important that we sort of try to transform whatever it is that people feel, or transform the practices that make people feel that they can't share those things.
What would you like Black women to know about their family's health and their community's health?
So I mentioned earlier that a seminal part of the work that I did was focused on Black mothers and Black mothering. And because of my understanding of human development, is certainly one that is concentric. We certainly are these individuals at the center, and we ripple outward. Certainly these are our individuals, our relationships, our families, our communities, and so forth and so on. That our health is interrelated. So as we are thinking about how issues of stress, our mental health and well-being impact us as individuals, it has certainly a ripple effect on our children and our families. The idea of, again, thinking about mothers and motherhood, childhood and maternal health is correlated. And I'm specifically thinking now of issues of race and gender. And in the research that I've done, we know that these are conflated often. So intersectionality really comes to the forefront as a critical issue for our families, not separating ourselves out necessarily and understanding what we deal with or what we cope with or what we understand or have a full awareness and knowledge of, has direct impact on our children, has direct impact on our choices that we make in our caretaking, our child rearing, and our relationships with our partners, our siblings, our parents, our grandparents. So the idea of relational frameworks, relational health and well-being is really critical to our overall family's health.
What would you like Black women to know about their family's health and their community's health?
I think about their family's health is that they have to be well to support it. So many times I see particularly older Black women who have forever been in the role of caregiver to children, to husbands, to their own mothers, to their own fathers, to their own aunt, their neighbor, their pastor, forsake their own care. And I always say that unless you're well, you can't help somebody else get better. So about their family's health, it would be that if their own health is not on course, then there's no way that they can be fully present and supportive of somebody else's health. So that would be my advice. And there's a second part.
Yes, their community's health.
I think it's an extension of that. I think we'll thrive better when we're surrounded by people who are able, when we're surrounded by people who are informed, when we're surrounded by people who are engaged. And if you're in that environment where your neighbor's talking to you about what their doctor said, and you're talking to your pharmacist about your medications, and you're talking to someone at church about prostate cancer screening, and you're hearing about how someone else is thinking about to put their mother in a nursing home or not. If you're engaged in the health of your community, be it in a supportive role or from a place of inquiry, your health is richer because of it. So again, healthcare is an active sport, and so people ought to be very engaged, not only within their own context, but also in their community to get the best out of it, but also to give the best back to their community.
Along the same lines, what would you like Black women to know about their family's health and or their community's health?
So, I feel like the pain that happens in society kind of trickles down and then feeds back and forth. So, minority people, Black people especially in this country, but minorities really all over the world, have experienced this pain of social isolation, right? So, sometimes on purpose being marginalized for some particular, to keep them in some particular role in society. Sometimes not on purpose, and sometimes these effects trickle down. And I think that societal pain kind of feeds back on us, right? So having had the history in America that we've had, there's always kind of this tenderness around the community, this sort of like hypersensitivity almost. And it's just the same as if you'd burned yourself and the area is kind of tender, you don't really want to touch it, it hurts. And I think that kind of societal pain, that community pain, feeds down into us. Like we take it in, and especially as women, we're more sensitive to it. Like we kind of resonate with the pain. And then it affects our children, especially our male children, like how they're viewed in society. And they also might feel kind of isolated, so it starts to reverberate. So how do we start to heal that? The tendency when you have a wound is to keep it protected. Just don't touch it. Keep it, make it heal. But for societal wounds, I don't think that works. I think for those types of things, we need to reach out and make connections with each other and with other people. So the more isolated you are, the harder it is, and the more it hurts. And so the more we, as women, can form communities, form connections with each other, form connections with other aspects of the community, make sure our children are embedded in society, the faster we'll heal.